everybody. So we had a little issue with our recording last night. Unfortunately, it didn't save everything, so we're going to be doing it this way in our little exam room versus in our big adjustatorium. I've got my little PowerPoint right in here, and then if you guys have any questions or concerns, we can send you the information, the PowerPoint, or a little handout the next time you come in. We'll definitely send you the recording. You just got to ask for it. So supplemental power, kind of covering a big spectrum of stuff. The main thing that supplements are used for is a lot of our nutrients are pulled from our diet because all the food is overly processed. A lot of different minerals that should be in like grains, fruits, vegetables, just aren't there anymore. When you pick organic food, you get a lot more of those nutrients. When you pick the non-organic or the name brand type stuff, those nutrients aren't quite as dense and they're not more readily available in the amounts we would like. But what we want to do is take those supplements and get those nutrients back into our body that are lacking from our diet. Now, when we're starting out and having a deficiency, we want to take a supplement to get a big infusion of that nutrient, the vitamin, the mineral, herb, whatever it is that you're looking to have. And once you do that, it raises in your body, and then diet can take over and try to keep that level as even as possible. Now the issue is you have water-soluble and fat-soluble vitamins, and then minerals that also follow where the water goes or wherever it's meant to. So the first one we're going to cover is vitamin C. Everybody knows about vitamin C. It comes from oranges. It comes from citrus fruits. It's really, really good vitamin. Now, the process for it is it's an antioxidant property. It's important in immune function, obviously, and collagen synthesis. So a lot of us have collagen in our system. A lot of it has collagen in our bones, muscles, well, not our bones, but in a lot of various places in our body, and we need something to help that continue to process. Now, when we don't have vitamin C levels appropriate in our bodies, we get what's called scurvy. Now, a lot of pirates, salesmen, Navy people back in the early years would get really, really sick. They would have no energy, vomiting, all kinds of bad things, and that's where scurvy started coming from. And they started noticing that people, when they'd eat, I think it was pickles or something like that, where the vinegar plus whatever vitamins they were getting in the pickled item, they were feeling much better. So vitamin C is really good for many things, but number one, immune function. I mean, it's not going to help you stop the cold, but it'll help your body fight it a little better on a more cellular level. One really fun part about vitamin C is oranges are good for vitamin C, but one that's even better, higher volume of vitamin C, are bell peppers. So the yellow, the orange, the red. Yellow is up here, orange, and then red. Primarily from the color, I'm not sure if we can have enough time to get into that, but there's a little interesting fact for you. And then on our information sheet for each thing, we have the recommended daily allowances, or RDA. So if you ask for the information, that's what that means, the recommended daily allowance. For vitamin C, it's 65 to 90 for adults, and for children, it's 15 to 75. Now, this is one of those water-soluble vitamins, so it comes in, goes where it needs to, and then leaves with the bathroom. So any fluid that's taken in with it, it'll go to that area, and then the rest is flushed out. So it's kind of hard to accumulate in the body at high levels or overdose levels, but we try and maintain that one. Okay, so the next one we're going to talk about for a minute, it's B vitamins. Now, everyone sees the B complex in stores. They see all kinds of individual B vitamins. We're just going to cover which ones are in this complex. So B1, B2, B3, B5, B6, B7, B9, and B12. Interesting fact is, since these are individual supplements that you can take, each one has its own disease or pathology when that particular one is low. The reason they do the complex is to make sure that all of it is covered, but the big important fact about B vitamins is they're important for energy production. Cellular level, B vitamins are used a lot. Another big thing is skin health, dermatitis, or if you have like cracking in the corners of your mouth that you know are not cold sores. B vitamin, as in B6 or B5, can be very beneficial. It'll help clear it up within a matter of days. Metabolism is one. Two really big ones are blood production and nervous system. So blood production and nervous system for vitamin B. Now, I had some issues in my hands and feet, numbness, tingling, but I had blood work done, wasn't diabetes, so trying to figure out what was going on in my diet. While I was in chiropractic school, we started talking about B vitamins, and I found out about B12 deficiencies. Now, B12 is the big one that helps with blood generation. So it helps generate new blood cells in a whole cascade of different steps. It's not just that one vitamin. But B12, when it's low or you don't have it, you start losing the ability to generate new. So it's called pernicious anemia. There's a whole other laundry list of symptoms that come with it. But with B12 and B9, those ones, so B9 is folate, so the folate acid that you get in your prenatals to help generate, to help lower neural tube defects. They generate myelin, which covers the sheaths, again, a whole cascade of other stuff, but these are really important when it comes to nerve health. So if nerves are damaged, not necessarily from a cut or when they're torn from an accident or something like that, but if they have, like your body is attacking itself or a couple other things, it uses B9 and 12, again with some other stuff, to help generate new nerve cells and new myelin to help protect those sheaths, to help generate those sheaths to protect the nerves. Good sources of B vitamins are whole grains, meat, fish, eggs, dairy, green leaves, and now again, this is one that's water soluble. So with certain ones, if you take excess of the individual, like B6 by itself, you gotta be careful because there are some issues. If you get too high a level, you just drink some water and it comes down, not very quickly, but it still comes down outside of your body, just waiting it out like you would with other type of supplements that are fat soluble, because those accumulate in the fat cells. But B9 and B12, I've been recommending to a lot of people who have nerve issues or cognitive issues because it goes and helps those nerves. Now the B complex, again, it covers a whole bunch of things to make sure that your body has what you need, and then when the body doesn't need that, it just flushes it out. Didn't have a recommended daily allowance for these because it's, B 1, 2, 3, 4, 1, 2, 3, 5, 6, 7, 9, 12, and I couldn't list all of those in the time frame that we had. Another interesting thing for B vitamins, the B6 and the B5, those were dermatitis, they help fix everything. Sorry, I'm kind of backtracking here. But the next big mineral that we're going to be talking about is magnesium. Now, I'm going to show you guys this. You can't see it very well, but each box is a different type of magnesium. There are 8 or 9 different versions. The ones we primarily see in grocery stores, health foods, supplement places, you have to look at the bottle because it just says like magnesium on the front, but you have to look at the actual label for the ingredient. Magnesium oxide and magnesium citrate. Those are the two that are the easiest to make. They primarily stay in the gut. They help with constipation is their big overall. Citrate does get absorbed a little better than oxide, but those come with the issue of a laxative effect. They make you go to the restroom quite a bit. So when you go in for like your yearly prostate exam or you have a stomach study that needs to be done, they usually flush you out with a magnesium of one of those two. Let's get to the other ones that don't have a laxative type of action in your body. Now, the big ones are glycinate, sulfate, chloride, L-threonate, malate, taurate. You can look all these up individually if you want. There is a magnesium supplement I recommend to a lot of people because it has all 8 in it, and then they can go to different parts of your body that your body stands in need of, because this one, magnesium is the most efficient in our diet. It's not very easily found in food because it's just not absorbed that way into grains or fats or anything like that. You can get some from greens, but you have to take a lot of those greens in order to get the desired effect you want for these. So let's start with glycinate. Glycinate is good for those who suffer with migraines. It's also really good for sleep. It's really good for anxiety and for inflammation. Let me backtrack 2 seconds. So glycinate, threonate, all those other ones outside of oxide and citrate, those are amazing for anxiety and depression. Now, those ones, glycinate will take, for example, it goes into the muscles and helps calm them down, and it gives a relaxing effect. It's not a muscle relaxer, but it's just a natural way for your body to process on a cellular level how to relax. I suffered from anxiety and depression before chiropractic school and a little bit in, because there's so much material we have to cover in order to pass boards, in order to be able to understand a lot of the diseases that MDs or DOs see. Now, we don't deal with pharmaceuticals at all. If we want to, we have to go to like 2 to 3 more years of schooling. Now with this, what magnesium does is it calms the central nervous system, and then depending on which one you want to use, threonate is the one that can actually cross the blood-brain barrier to help calm your mind down when you want to try and go to sleep. It's got an energizing effect if you have enough in there. So if you're feeling really groggy or brain foggy, threonate can also help with that. Now, we already covered glycinate. Let's talk about malate for a second. It's good for fibromyalgia. So fibromyalgia is kind of like an umbrella term for pain that we just can't find out where it's coming from. We try our best to see if it's musculoskeletal as chiropractors. Medical doctors will do MRIs, CTs, nerve studies, all of those things. And when they just can't have something definitive for you, they list it as fibromyalgia. Now, unfortunately, they don't really give much in the way of help other than pharmaceuticals, muscle relaxers. Dietary good, so they want you on like an anti-inflammatory diet, which sugar is the #1 inflammatory thing in most diets, but with this, it kind of helps calm the nerves down that are irritated, calm the muscle down. Now, if you're trying it and it's not working, it could be that you need another one, or something else is going on underlying that particular pain that we would have to look into. Taurate is really good for heart health, also good for migraines. Promotes stable blood sugar. It's difficult to find good brands that are not mixed with other forms. Now, the one I started using in school. I slept better, I could focus better, and I didn't need caffeine to get me awake in the mornings from studying 8 to 12 hours a day. I would sleep, my body would wake me up, but it wasn't the grogginess that you get from melatonin. Then I tried melatonin for the first little bit of school until we started talking about nutrition, and I found that it made me so groggy. It was just really hard to try and wake up. Eventually I would, but that's the big thing with melatonin, is it's supposed to put you to sleep. It doesn't really keep you asleep, and that's one other thing that people have a misconception on. The magnesium calms the whole body down in a very similar way, but you don't get the grogginess from melatonin. If you take them together to try and help you fall asleep a little better, maybe you just have that issue of melatonin needed in order for your body to fall asleep. Not going to say it's good or bad, but just if you notice that you're groggy in the morning, try a magnesium before the melatonin and see if that's more beneficial for you. Now, the really, really, really big thing I want to cover with magnesium is anxiety and depression. Now, anxiety and depression is the body's way of telling you something is anxious anxious or something is offsetting you. Now, if you've had anxiety and depression for a really long time, but you don't know what your triggers are, and you're taking antidepressants, they're just not working for you, we really want to figure out what you're missing overall, which is why we usually recommend magnesium. We don't want you to be off the antidepressants. You need to talk to your doctor who prescribed them to see if you could lower the dose. If they can, great. We just want to introduce magnesium to help your body on that cellular level and see if we can get some benefit from it. So anxiety, depression, inflammation, it calms the mind, calms the body, allows you to sleep or have less anxiety. And one other caveat, so I don't like flying. I don't have a fear of heights per se, I just don't like turbulence, I don't like being crammed and all those little things. So not claustrophobic, I just don't like flying. I would always get a little fast heart rate whenever I would go, but I started taking a magnesium before my flight rather than an anti-anxiety medication, which I tried for a little while, and I didn't like what that did to me either. So I tried that. Magnesium calmed me down. I either slept on the flight or had a much calmer 2-hour flight from here to Texas where I went to school. Okay, so let's move on to vitamin D. Now, vitamin D, this one is very interesting in what it does. So it promotes bone health, immunity, it helps with your immune system, overall physical health and mental health. So a lot of interesting things happen to us here in Utah, primarily because when this winter hits, everyone starts getting sick. Even if you're not around anybody that gets sick, you just start feeling like you're sad, depressed, even the seasonal affective disorder. A lot of that is due to vitamin D because vitamin D is synthesized through our skin. We get the sun on our skin, it goes into our body, goes where it needs to, goes into our brain, and it just kind of regulates things. When winter comes, we cover up. We put our coats on, we put our blankets on, we don't go outside as much because, well, the weather is horrible. When the sun comes out, then we get a lot of burning because of the reflection of the snow, so a lot of people stay inside. Now, the issue with that is when we don't have the vitamin D, it lowers our body's immunity status. So we have to supplement with vitamin D. But the other thing is you need a UV light, also called a happy light. It helps with seasonal affective disorder. Now, people who are using the happy light and not noticing much of a difference, it's probably because they need to take that vitamin D to bring that level back up so that their body can have that proper level for wherever it's supposed to go. Now, magnesium and vitamin D should be taken together. The recommended daily allowances are very, very different. So the vitamin D is done in international units, so it's a much smaller amount, and the magnesium is done in milligrams. So if you can find one that comes together, usually those are proportioned pretty well. If you need to take them separately, then you just gotta see what age range you are, and then we can help you distinguish which levels you would prefer, or your body would prefer. So started taking vitamin D and magnesium myself. I usually do it over the winters. This last winter I didn't, and I did not have a very good time over Christmas because I was sick for about 2 weeks. And that kind of went through everybody, not necessarily my family, but a lot of people in the Salt Lake Valley. All right, so next we're going to move on to a mineral called iron. Now, iron's essential. It's important. It is fundamentally needed for our bodies to survive. So what it does is it creates the hemoglobin, part of the molecule in our blood. It's where the oxygen adheres to, travels to wherever it needs to in the body. It releases, gets replaced with CO2, comes back, and processes through all over again. Now, when we're low in iron, for a lot of the female patients, it's the monthly cycle. For certain people that have celiac disease, where their blood kind of ruptures, there's all kinds of anemic problems for certain people. We want to take iron in the form of meat, beans. There's even some iron in broccoli. There's a few ways to get it. The only issue is this one, if you get too much in your system, it can have a negative effect. And those are few and far between when you're eating just the diet. But if you're using supplements, that can increase a little more. But again, with the monthly cycles, a lot of people recommend an iron supplement. Same thing here. It can just be a benefit mentally. If you don't have enough red blood cells in your system, you can get headaches, migraines, you're feeling tired all the time because you're not getting that oxygen where it needs to go, because there's nowhere for it to bind in the blood. If any of that makes any sense to you, a lot of people probably would be nodding along with that. Recommended daily allowance for adults is 8 to 18 milligrams. Pediatrics, 7 to 15 milligrams, so it's not very big, but depending on where your source is from, it can be a lot of food or it can be just a little tiny supplement. Most iron supplements are like not even that big. They're pretty tiny. Now we get to one big portion, herbs and spices. Oh, okay, let me take a breath here because there's 5 that we're going to cover in the next 8 minutes. So ginger, turmeric, however you say it. Don't blame me for me sounding funny. I just call it turmeric. Apple cider vinegar, beets, and cayenne pepper. Now, ginger and turmeric are the 2 big anti-inflammatories when it comes to herbs. Now, those are used in like curries and a lot of different soups to flavor and color stuff. The really good part is that both of those aid in digestion, their antioxidant properties, and the anti-inflammatories. So when we talk about Tylenol and ibuprofen being non-steroidal anti-inflammatories, they don't really pull the inflammation out. They just stop the body's ability to accept the pain molecules or the inflammation molecules into our cells. What this kind of does is it gives something else for the body to adhere to and relieve the inflammation, relieve the pain. So if you have sore muscles, if you have a chronic pain illness, a lot of people are put on turmeric and ginger to help with those anti-inflammatory properties. Let me get to the end because I'll explain a little bit more on those because I have a supplement that has most of these in it. Apple cider vinegar. Apple cider vinegar helps with digestion and blood sugar control. Now, this one helps also clean out veins and arteries in our system because anybody who has fat buildup or plaque, apple cider vinegar kind of alleviates, or not necessarily breaks down, but gets rid of those. Again, it's a whole process, a whole cascade of things, but it also is really good for immunity. So when you take it, you'll feel a little bit of burning because it is a vinegar. It's very strong, so I have to put it in water in order to dilute it. But the benefits I've seen in my stomach and in my overall awareness of how my heart feels, it's been very beneficial. Last 2 are beets and cayenne. Now, beets are rich in antioxidants and nitrates. Nitrates are huge for the body because nitric oxide is what allows the blood vessels to open in your system. It's not going to like lower blood pressure really quickly, but it's supposed to help with blood pressure. It helps with heart health and blood circulation. Now, when you take beets, I don't like the taste of them, I don't like the texture, but I do have a little capsule that when I take, I do get a little beet taste once it's in my system, but after that, it's good. I actually feel a little more energy from it. So if you love beets, keep eating them. If you don't, we have a way to either use the powder in a drink form with lots of other fruits that help with the taste, or you can take little capsules like I do. Cayenne, it contains capsaicin, which is the heat molecule in peppers that when you bite into them, that's what burns, or that's what stimulates your mouth and tells your brain, hey, this is hot, or ouch, this hurts, when it comes to jalapenos, habaneros, all of those ones. It's also the burning sensation in some pepper sprays. So the big thing for cayenne is it aids in digestion, blood circulation, and metabolism. It has been shown to help with ulcers too. But a lot of people have a medication that they take with ulcers, just depending on how severe those ulcers are. So cayenne helps with circulation. Now, I've noticed since taking my cayenne, so my supplement has cayenne, cayenne, ginger, apple cider vinegar, vitamin C, and I think one other thing, but I've noticed that my hands and feet are actually warm. Now, I've gotten some compliments and comments from people here as well as in school when I was taking it that I was the only doctor that ever had warm hands. I was kind of surprised about that, but a lot of people have blood circulation issues. Now, this can generate warmth in your body. It can generate warmth into your hands. Now, people with Raynaud's or poor blood circulation, this can be beneficial because it opens up those blood vessels. Because with Raynaud's, you get cold and the capillaries start clamping off, and it's really painful and it sucks. And so beets and the cayenne can be beneficial for that. So if you have any interest in any of those, I can show you the supplement I have for, I think it's actually called a detox because it overall helps the body calm down, or inflammation calm down, and alleviate some pain in like joints and poor circulation. Now, that's the end of my PowerPoint. I hope everyone learned some good information. If you have questions about other supplements, I'm more than happy to do a little research, and if it's not something I'm familiar with, give you the information that you need with regards to how it can benefit you. Now, chiropractic is definitely a lifestyle. It's not just a, hey, I'm going to go until I'm out of pain, because what happens when your body's moving good, you feel better, you don't feel like you need the chiropractor anymore. And we're okay with you feeling better. The only problem is if you haven't understood how to keep your body moving, then we have an issue. If you haven't understood how supplements can benefit the inflammation, then we have to educate a little more. But we want you to know that we are always here, and we need to provide you with the information to keep you healthy longer and your spine moving better, because the spine is what generates overall health. And if it needs a little help from a supplement, I'm more than happy to discuss it with you. So I hope you guys enjoyed this video. If you have any questions or concerns, let us know.